Hi everybody, so this is just a short information video just about how to deal with some sensitive teeth. A few patients have been calling about this and they're just a little bit concerned as to how to manage this. This is actually quite straightforward, quite simple. First you want to identify what is it that's actually causing the sensitivity. Is it an ice cream? Is it something cold? We want to try to avoid that stimulus, of course. If it's general sensitivity, this is very, very common. What I would say is, firstly, try and find yourself a sensitivity toothpaste. So this is one, Sensodyne, okay, and this is another one, Colgate Pro Relief. There's a variety. I'm sure many of you have them already at home. Otherwise, obviously, you can buy them on the internet. When you're brushing, it's important, spit out, do not rinse, because you want the toothpaste to stay on the teeth and on the areas so it can sink into the tooth and help reduce the risk of sensitivity. You can then, on top of that, after you finish brushing at night time, take a little bit of toothpaste, pea-sized amounts, it's not a problem, and you can rub that in around the teeth to let that sink in. The other thing, which I know I've mentioned to many patients who've had sensitivity, is you can get something called tooth mousse. You can buy this over the internet, off Amazon. It's called tooth mousse. It's made by a company called GC. It comes in a variety of flavors. I appreciate there's delays in things being delivered at the moment, so that might take a little bit longer. It's not a toothpaste, it comes as a gel, and you take a little bit of it, again, pea-sized amount, and you rub it on the tooth or the teeth in the areas where you have the sensitivity, and you leave that on overnight. You can do it once or twice a day, that's not a problem. For those patients who have done bleaching, for example, or for patients who have mouth guards to help them with clenching and grinding, if you have sensitivity as well, you can take your toothpaste and you can place it in your trays, okay? As if you were to be doing tooth whitening or bleaching, and you just place it into each of the different areas, tiny little bit, all the way around. You don't need a lot. A match head amount into each of the little areas, because as you seat it into the mouth, the trays or the gum shields into the mouth, the toothpaste will squeeze out across the teeth and be in contact, and that will also help with some sensitivity. Also, when you are brushing, what I would encourage you to do is to take the toothpaste and use our little TP Interdental brushes, which I hope you're all using anyway, and you can place the toothpaste and you can use the brush to make sure it goes through the teeth, okay? So it gets pushed through with your TP brushes, okay? And that way we know it's going all the way around and it's covering all those areas. And that's what I would do sort of short term and just to help with regards to sensitivity. But of course, if there are any problems, if you're struggling to manage this on your own, please do message us directly at the practice, and we will of course call you back, even happy to do a FaceTime conversation if necessary to show you how to do things. So I hope that's helpful.